friends, welcome again to your own YouTube channel Ask Your Gynecologist. I am Dr. Sonal Parihar and as usual I am back with a new video which has been suggested by you people. Okay, so today we are going to discuss about intrauterine death, that is fetal demise inside the uterus. Before I start with the topic, I would just tell the audience, the people who are listening to me, that DocWise app is doing very well. DocWise application is an application which you have to download on your mobile's Play Store, right? And then you have to connect with me through my PIN. This is my PIN, and then you can easily send your reports. You can send me voice messages. You can request a call from me. I can call you. It's a wonderful app, and many patients, including me, we are enjoying chatting because whenever I get time, I tell them what to do. I send them voice messages. I call them. I can even give a prescription if needed. Okay, so I think it's a wonderful app. If you need any technical support, these are the two technical support numbers. You can either WhatsApp or call. The lines are open from 10 a.m. till 8 p.m. in the night. If you really want to come to my hospital and consult, then this is my hospital's address. This is a landline number, and I have a secretary who can attend to your calls till 8 p.m. Please do not call after 8 p.m. The etiquettes, the manners have to be taken care of, right? So 10 a.m. till 8 p.m. you can call my secretary if you need any technical support. Right? Otherwise, you can always follow me on my other Facebook pages, my Instagram, my Twitter. But please do not send any medical questions to these channels. Unless the question is getting missed on YouTube, then you can always request me there. But YouTube is meant for the medical questions. Right? So we start with the topic now. Well, intrauterine death, as the name indicates, means the fetus is dying inside the uterus. Now, technically, if you look at the book language, if you look at the definition, then intrauterine death terminology is given to babies, the fetuses which are above 5 months, because at 5 months, the weight is approximately 500. So, 500 grams is not supposed to be a fetus, it is supposed to be an abortus. So, if the baby dies before 5th month, that is when it has not completed 500 grams, it is less than 500 grams, then it is said to be as complete abortion, right? Or spontaneous abortion, not complete but spontaneous abortion, that is the baby has died automatically inside the uterus. And if it is above 5 months, more than 500 grams, then till the 9 months it is called IUD, intrauterine death. Now there is another terminology which is called stillbirth or intrapartum death. They are the same. Intrapartum death or stillbirth, as the name indicates, it is the death of the baby, the fetus, during delivery, when the pain has started, either when the baby is coming out or inside the uterus when the pains have started. Now it is very difficult to differentiate between IUD and stillbirth, especially in women who have not got their examination done before the labor came, before the labor onset. Okay, sometimes the patients, they come in emergency to the hospital, they're already laboring. It's very difficult for the doctor to decide whether the baby actually died due to the pains or baby actually died inside the uterus before the pain started. Especially when I'm practicing in India, especially in Rajasthan, home deliveries are still very common. Now, so home deliveries, guys, is very dangerous because the fetus, the baby as well as the mother, they are in grave danger. If there is any problem, if suppose the baby needs any special attention of the pediatrician, at that particular time, the baby will not survive more than 5 minutes if we do not, if the pediatrician does not attend immediately. So at home, when even a trained doctor is performing delivery or a trained nurse is performing delivery, there are no machineries which we can use. So just by bare hands, we cannot save the mother or the baby. So please avoid home deliveries, especially the diet deliveries who do not even have a fetal doptone. They don't even know how to listen to the fetal heart. They will just pull out the baby, right, and they will hand over a dead baby to you. And at that time, you will be like shattered because you don't know what to do. Right? So come to a hospital where all the machineries are there. At least we know what is happening, that during delivery, if the baby's heartbeat is going down, we can always do an emergency cesarean section. So please do not play with your health. Okay. Now, if you look at the incidence of this, then it's almost 1 out of 200. So it's quite common. Stillbirth rate is 1 out of 200. Okay. Now, what are the causes? Well, if the baby is dying inside the uterus, then obviously there has to be some problem either in the mother. Either the mother has a medical disease, or in the mother's womb, that is the uterus, or in the baby itself, that there is some problem in the fetus, or there is a lot of stress in the mother. Well, stress is a very important factor because in today's lifestyle, because of increasing stress, a healthy woman turns unhealthy. right? And all the nutrients that she is supposed to pass on to the baby, they do not happen. That does not happen. So you really need to take care of your stress levels, right? And what can be the fifth cause? The fifth cause and the most important cause is the placental problem, because placenta is the connection between the mother and the fetus, and the fetus derives all its blood and the nutrients from the placenta. So coming to the maternal diseases, well, the mother, if she's suffering from high blood pressure or diabetes or uncontrolled thyroid or liver disease, renal disease, brain disease, any kind of systemic disease in the mother can lead to decreased nutritional support to the baby and decreased nutritional support through the placenta, because the placenta development is always hampered, right? Coming to the maternal uterine problems. Now, if there is any problem inside the uterus, which we have discussed in the previous video, of bicornuate uterus, a septate uterus, a uterus which has fibroids, a uterus which has adenomyosis, any kind of problem which does not let the baby, the fetus, to implant inside the uterus and get a proper environment to grow, that can cause IUD. Coming to the fetal problems, well, the baby can be congenitally abnormal. The baby might have some structural problems. The baby might be suffering from some chromosomal problems in the form of Down syndrome, Edwards syndrome, Patau syndrome. These are the three syndromes which we normally check in your blood tests. Triple test and the double marker tests are basically tests to detect these three common syndromes, and these are very common causes of intrauterine deaths. Okay, baby might be having some infection. Any kind of infection can lead to IUD. Even sometimes sudden separation of the placenta, which I have already discussed in bleeding during pregnancy, that is abruptio placenta, that can suddenly cut off the blood supply of the baby, and that can lead to IUD, intrauterine death. So these are certain causes which you should keep in mind. Placental problems. Generally, the most common problem of placenta is placental insufficiency. Placental insufficiency means the blood supply to the baby and the nutritional support which is supposed to come from the placenta and the hormonal support which the placenta secretes, that is improper for the baby. So the environment which the baby is getting is not good. Even the liquor, the fluid that the placenta secretes might be less because of placental insufficiency, and it generally happens in ladies who are unhealthy, either in the form of anemia or in the form of any systemic disease which I have already told you, right? So these are the certain causes, and what you can do to prevent them? Well, you just have to stay healthy. You just have to be careful about your diseases. You have to obey your obstetrician, your doctor. You have to go and see a doctor regularly. If they're calling you every 15 days, if they're calling you every month, you have to be attentive. Please register with a gynecologist as soon as you miss your period, say 10 days, as soon as you go 10 to 15 days above your period, go and get an ultrasound done, an early ultrasound. I'm telling this again and again because many patients are still asking, ma'am, why so many tests? Why you test at 6 weeks? Why it's just 1.5 months? Why are you doing an ultrasound? So I have already explained this in detail in my video, the type of tests, the pregnancy that have to be done during pregnancy, the type of ultrasounds, how many ultrasounds, and why we do all this. Right? So you have to take care of yourself and you have to obey the doctor. Eat healthy, stay healthy, be aware of the diseases, be aware of your fetal movements, because you need to know that the baby is moving. Okay? So unless and until you are alert, you will not be able to know what is happening inside. And you have to stay away from unhealthy habits, stay away from people who are unhealthy, who are ill, because you are pregnant and you will catch the illness very soon. Now, suppose the fetus has died inside. What are the symptoms? How will you know? Suppose the baby is just 3 months or less than 3 months. You might have bleeding or you may not have bleeding. Okay, which I have already discussed in my video of types of abortions. Now this is nature, we don't know why this happens. Some patients, they start bleeding as soon as the baby dies. Some patients might not even bleed for 2 months, 3 months, they all together. That is called missed miscarriage. A baby, a fetus which is dead inside, in that case, remember, if you're alert, you will come to know you will not pass fresh blood. You will pass dirty, muddy color, brownish colored blood. That indicates that the baby has been dead for a long time. Okay, so if it is less than 3 months, the doctor can easily admit you and do a dilatation and curettage, which is a suction and evacuation, a surgical termination. But what happens if the baby is above 3 months? Above 3 months, baby is big enough like a doll and it has to come out like a delivery. And the pain might be very excruciating. We do not let you go home because we have to admit you. We generally do not do a surgical abortion. We have to give you abortion tablets and you have to be admitted till you pass the baby out, because you will need assistance from the nurse and the doctor. Okay, so whether the baby is 6 months, 7 months, 5 months, you will need artificial pains so that the uterus opens up and the baby is expelled out, right? So sometimes patients do ask me, ma'am, what happens when the baby is dead inside? Will I die? Will I have some poison inside me? Well, that's all theoretical. Some books, they do say that the dead baby will secrete some thromboplastin type of structures, thromboplastin type of tissues or factors, the blood factors, which might cause bleeding in the patient or some health problems in the patient, in the mother. But technically or practically, I've never seen it. It never happens. I've seen babies dead inside for 3 months, 4 months, and still nothing happens, right? So just be alert. Now the last thing is, what kind of foods you can avoid? Well, if you watch my video of what to eat in pregnancy, what not to eat in pregnancy, then you will easily come to know that I have told you certain foods have to be avoided, and the reason I've told you is they can easily cause either miscarriage or an abnormal baby or IUD or a stillbirth. So just be careful, avoid uncooked food, avoid sprouted vegetables, avoid high mercury seafood like fish and all, high mercury ones, avoid vitamin A, avoid undercooked chicken and meat, and I will not go in the details because otherwise you will not watch that video. Please watch that video, it is an excellent video, and you will come to know many things through that video. So just be alert. I guess you don't need to know anything more about stillbirth because this is enough, and you just need to be alert, you just need to obey your doctor, and just be alert of the fetal movements, because if the baby is dying say after 5 months, then you can easily make out what is the difference between the movement, a kick of a baby when the baby is actually live and kicking you with his hands or his legs, and the abnormal movement of a dead baby which is just floating inside. Because I've seen many patients coming to me, ma'am, the baby was moving, how are you saying that it is dead for the last 2 to 3 days or 5 days? Because we can easily make out that in the ultrasound that the baby is dead for more than 2 days or 3 days, because then we can see the changes in the skull bones, in the heart defects, and there are many other things that we can see in the ultrasound and tell you that it is not a fresh IUD, it has been dead for a couple of days. So you just need to be alert. What is the difference between, there is a lot of difference between a live baby kicking you and a dead baby just floating around in the amniotic fluid. So just be alert, guys. Women, you have to be alert, you have to be careful about your baby, because if you are alert, then you can save the baby from all these problems, right? So just keep sharing and liking my videos, keep sending your requests, you keep sending your topics which you want me to make a video on, keep sending your questions. I love interacting with you people. In the last 20 years of my practice as a gynecologist, I'm really loving interacting with you people, because it is not just in my own vicinity that in sitting in Jodhpur, I'm reaching out to people, I'm reaching out to patients abroad, I'm reaching out to patients in UK, in USA, in Singapore, Kuwait, Iraq, and like so many patients abroad have been connecting with me through DocWise app and through YouTube. So I'm really loving it. So guys, take care. Please wait for my next video and keep sharing and keep liking this video. Thank you very much.